Hello and welcome to Health Matters on Channels Television. Thanks for joining us on the program. I am Mary Alale Yusuf. It's been said that people with flat feet are not admitted to the police force or the army. A person has flat feet when the arches of the feet collapse. Now, an arch, according to the Cambridge Dictionary, is a structure consisting of a curved top on two supports, which holds the weight of something above it, which means a normally formed foot is curved. How much of a problem could flat feet be? Let's find out today. On the show with me is a consultant orthopedic and trauma surgeon with bias in pediatric orthopedics and limb reconstruction at the National Orthopedic Hospital Igbobi in Lagos. He's Dr. Adebayo Owola. You're welcome to the show.
Thank you very much.
All right then. I never used to think that flat feet was a problem. In fact, I thought flat feet were good because, like, you have a firm grip on the ground. Most babies I've seen come with flat feet. So what's the issue?
Well, the issue is that flat feet is not actually a big problem, but in most people, but it could be in some people. We have two kinds of flat foot. Mm-hmm. There's one we call the flexible ones,
okay,
and the rigid ones. But majority of people have the flexible ones, which means they may not even have any symptoms, and these ones are the ones that are usually correctable over time. Okay. Usually when you have a newborn baby, if you look at the feet of a newborn baby, you find that it looks like all babies will have a flat
Yes,
foot.
That's what it
But
looks
really
like.
they don't. It's because of the fat that is in the foot that makes it look like as if they have a flat foot.
So it's padded.
It's padded. So however, when the child starts to grow up, this fat burns away, and then the normal shape of the foot becomes evident. In some of them, the arch is not formed properly, and as you define the arch at the beginning of the program, it's something that is curved like this with support
on both sides. Which will be the heel,
exactly,
and then the ball of the foot.
So that support is made up of the bones of the foot and some ligaments and muscles.
Okay.
So any problem with any of these three will lead to the loss of that arch. And when that arch is lost, the inner side of the foot touches the ground when you stand on a flat surface.
Okay.
So when you have the inner side of the foot being abnormally low and touching the floor, then you say the patient has a flat foot.
When they do have symptoms, what symptoms do they have?
Now, like I said, majority of the ones we have are the flexible ones. They usually don't have symptoms.
No symptoms, okay.
And most of them will correct as the child is growing up. And some of them have what we call ligamentous laxity. Some of their ligaments are lax. That's just the way they are. And some even have family history of flat foot. The mother or the father may have it, and so the children are likely to have it.
Also, they inherit a flat foot.
It can be familial in the sense that if the parents have it, the children too may have it. But like I said, majority of them are flexible. They don't have any symptoms. In fact, most of the time they come in because the mother or the grandmother, as the case may be, is worried that the foot looks not like the other child's foot.
Okay.
And they start getting worried. However, once they come to us, we examine them. We do an X-ray of the foot to know whether this is the flexible ones or the rigid ones. And once it is the flexible ones, all we do is just to assure them that over time, this will correct as the child is growing up. Now, the term flexible comes from the fact that when that patient or when that individual who has the supposedly flat foot stands on the toes of his or her feet, the arch reforms back.
Okay.
So you can try this at home. If you think you have a flat foot, just stand on your toes, holding on to something, and see if the arch if the arch forms back, then what you have is a flexible
flat foot. Which means it will change shape when it needs to.
Exactly. So which means you really don't need to worry yourself about it. It doesn't cause any problem, and you can live with it for the rest of your life. Okay? So, however, when these children comes and there is no improvement, because of the fact that they are worried, we tend to treat them in a way. We send them for physiotherapy
Okay.
to help them to strengthen the muscles and the ligament that forms the arch, in the hope that this will help the arch to reform back.
And does it help? Does it?
It helps. It helps because some of them, like I said, have ligamentous laxity.
Okay, so you just strengthen those ligaments.
Exactly, and in this category of patients, it does help. The other thing we do is to also teach them these same exercises at home, and which they can also do at home. If this doesn't work, then we use what we call molded foot inserts, in which case we put this insert in the foot.
Okay, before we go further on that, I want to know, is it really true that, flat-footed individuals, of course, no pun intended, don't get admitted into the armed forces?
Well, I've heard about that too, and I think the worry is that the shape of their foot will not enable them to stand for a long time.
But from what you're telling me,
yes,
if the foot is flexible,
exactly,
then it shouldn't be a problem,
It shouldn't
right?
be a problem. So what we need to do is to find out whichever army recruit we want to admit to the army or the police, what type of flat foot does he have? Is it the flexible one or the rigid ones? In fact, studies have shown, there was a study done in Canada for 3,600 Canadian army recruits with flat foot, and they were all evaluated over a long period of time, and they found out that they didn't have any physical problems.
They can stand as long as any other
exactly,
person.
Because it's the flexible ones which doesn't give any symptoms. In fact, some authorities have actually said flat foot is just a variation of the normal.
Okay.
That is really not a problem. The ones that are really a problem are the ones that are the rigid one, which we'll talk about later.
Tell us about the symptoms of the flat foot when it's rigid.
Now, when it is rigid, the test I asked them to do before, like standing on your toes, and the arch will reform. In those with rigid foot, the arch will not reform. It means there's a problem. And the problems can be because of the bones of the foot. Some of the bones that are supposed to form the arch can be abnormally fused together.
So many bones, up to 60 bones.
Exactly.
In there.
So some of those bones can be fused together. That's what we call tarsal coalition. Okay. It's a condition that is not so common, but when it occurs, it can give a patient a rigid flat foot. Another one is what we call an accessory navicular bone. When there is a bone called the navicular, which is at the summit of this arch. Sometimes it can have an accessory bone that is
okay. Let's explain this. The summit of the arch. Yeah. So let's say the foot is like this.
Okay.
These are the toes, yeah, and this is the heel.
Exactly.
So this is where the problem is happening, at the top of the arch.
Yes.
Is that what you're saying?
Yes. If the bones that forms the top of the arch are not in their normal position, if they are abnormally fused together, because they are not supposed to be fused together, they're supposed to have joints in between them.
Okay.
When they are fused together, they can disturb the arch, and then you have a flat foot. There is also something we call a vertical talus. There is a bone called the talus in the foot. That also forms the initial part of the arch. If that talus, instead of it being horizontal like this, is vertical,
okay,
then it disturbs the arch. Okay. And another causes are people with spinal disorders, like a patient with cerebral palsy or spinal bifida, or even poliomyelitis, who have nerve issues. Those nerve issues will affect the muscles that form part of the arch. And when these muscles are weak, the arch will not form normally.
Okay, so now the muscles are weak,
yes,
as a result of that condition.
Exactly.
Maybe the spinal bifida, exactly, or the cerebral palsy.
Or poliomyelitis, as the case may be.
So they just normally have weak arches.
Exactly. So in those patients, they will have a flat foot, and their own will be the rigid type, which will not be correctable when they stand on the toes of their feet.
So do they go through pain or something?
Yes. The major symptoms you have is pain, because when you stand, you are not supposed, the inner part of your foot is not supposed to be touching the ground. When the bones are touching the ground, it's like, bone is not as soft, it's hard.
That's right.
So when it is not touching the ground, patient will tend to have pain, in addition to the deformity that they have, which is quite obvious. In them, their own flat feet are usually more gross than the ones that are flexible.
Okay.
So pain is a major problem that they come with. And so when they come with that, you have to do something, and you have to find out what exactly is the problem. Is it the bone, is it the ligament, or is it the muscle?
Oh, so
and
it could
address
be any
as
of
such.
those three?
Exactly.
If it's the bone, it's usually a coalition, as you call it?
Yes, tarsal coalition.
Tarsal coalition,
Yeah.
okay. Now, but if it's the tendons or the ligaments,
Yeah.
do you have to do an operation?
Yes, you may have to do an operation. In fact, in most of the cases of rigid foot, you will need to do some form of surgical operation.
Does it involve breaking the bone, the fused bones?
Yes, if it is a tarsal coalition, you may have to break those bones, because the bones that are fused together, you have to break them and make sure that they are no longer fused together.
Okay, so I'll come back to that a bit later. But I want to ask, does it affect the way they walk?
No, it doesn't really affect the way they walk. The only thing is that they have what we call an abnormal shoe wear. And sometimes, most of them actually come because of that. Because their shoe will be wearing out on the medial side, on the inner side.
The inner side.
Exactly. As opposed to...
Which is really odd. Usually it wears out on the outer
side. And so, actually, most of them will come, not because they have pain. Some will come because of the pain. But some of them will say, look, I just don't like the way my shoes wear out. And people tend to laugh at me, that kind of a thing. So that is the major complaint, that their pain is their major complaint. So when they come, we do all our tests, and once we find out that it's the rigid type, we find out what exactly is the cause, and then we address it in order to solve the
problem. It seems to me that, when one goes to a doctor and talks about pain, maybe in the foot, in the knee, or maybe the hip, the doctor starts to talk about arthritis. So how do you differentiate between the two, that no, this isn't an arthritic condition, it's a flat foot that is causing this problem?
Okay. Now, the word arthritis means there's an inflammation of a joint or joints. And when you do an X-ray, you will definitely see evidence of the inflammation in the X-ray. Okay. And so that way you will know that this is not an arthritic condition. This is not due to an arthritis. Your foot, the pain you're having is because these bones that you see that are joined together are not supposed to be joined together. They're supposed to be individual bones with a joint in between them. And then this bone that is like pointing down, supposed to be pointing forward. That's the vertical talus. And then we'll be able to differentiate between it. It's very easy. Okay,
so can we then say that the X-ray is a definitive way of finding out what the problem is exactly?
Yes, for those with flexible flat foot, usually we diagnose them even without X-rays.
Standing on their toes.
Just the history and the physical examination. Okay. We can do that. But usually we do an X-ray just to have a documentation that there is nothing underlying that is causing this. Okay. And so once we do an X-ray, most of them will be easy to diagnose. However, if you still can't find the diagnosis, you may have to go on to do what we call an MRI. Because, like I said, some of them are due to ligament and muscle injury, and some of these will not be shown on the X-ray. So sometimes we may go a step further to do an MRI, which will show the soft tissues, the ligament, the muscles around the bone better.
Okay, so I'm really intrigued about this surgery. So let's say the person's bones are fused, and then you go in there and break them up. How do you get the foot to work flexibly after that?
Okay, now what we do is that, it depends on the condition. If it is what we call the tarsal coalition, what we do is to break the bones and put what we call a bone block, something in between them, such that they will not become fused again, and then they will become
like
mobile.
A joint.
Exactly, so that they will not become a joint, something like that. We put something in between them. Sometimes we put fat, sometimes we put fascia from another parts of the body in between them.
What's fascia?
Like fascia is like a thick band that covers the muscle. We can take some in areas that are really not important and put it in between them in order to make this work. Okay, that's great.
Let's just quickly take a short break, and we'll be back right after the break. Stay with us.